We initially approached Premier, and they had indicated that they signed up as an ORDI convener themselves. So our initial pitch was really to start with the data and help them understand where their opportunity lied.
We first heard about bundled-based payments back in 2014, and we were looking to get into the program, and we got the Medicare data, and I said, I have absolutely no clue what this is saying. And then we met Remedy.
Up until the recent time, it's been all about billing as much as you can, get patients to stay for longer periods of time, in some ways promoting inefficiency within our profession.
Well, before I would say a patient would go see the surgeon, some patients went home. Most of them went to a facility. I would say minimally they were there probably 30 days or more.
When we started educating them about the costs in the system, they were really taken aback. And they realized the importance of taking more control from the pre-op all the way through the 90 days.
We sat down together, the entire Premier team and the Remedy Ortho team, and we described the patient experience, and we figured out what worked and what would work better to provide good care for our patients.
This pre-op is an opportunity in the bundled universe because it starts the conversation with the patient, letting them know where their next site of care is going to be and the next step after the surgery.
So patients go into these surgeries or come to our office for their pre-op visits with unanswered questions. For whatever reason, the patients don't ask the doctors these questions. This gives them another chance to do that.
In addition to getting the key leadership at Premier surrounding the table to implement this process, we needed to standardize it. So how could they roll it out to all the different practices? How could they roll it out to all the SNFs that they were going to refer to?
After go live, we saw dramatic shifts of patients going from more restrictive and higher cost facilities like skilled nursing and inpatient rehab to home health or home with limited services with significantly lower readmission rates.
I mean, what used to take probably 6 to 8 weeks plus for like an average joint replacement, we're looking at 4 to 6 weeks max.
It's brought Premier together, and I think going forward it'll bring us even closer, and it will give patients satisfaction that all the doctors work the same, and we know we're going to get the same care within all of Premier.
My passion is I want great care for our patients, and I want to save the taxpayers money. Working with Premier, we were able to do that. We combined our expertise, we combined our mutual goals, and it worked. Working together works.
This partnership between Premier and Remedy has been a perfect match. They've been imperative to educate our team, and so that we not only understand the ins and outs of bundle payment, but also know all the parts that we have to control from our end.
When Premier, luckily, was a perfect partner to pilot this workflow. We had the physician leadership we needed. We had the C-suite leadership that we needed to be able to decide as a team what the interventions would be and have the leadership on their end to roll this out efficiently among the different practice locations and among the different surgeons.
The partnership with Remedy was very integral. They showed us the importance of having case managers doing the analytics for us, showing us the dashboard, showing us where we're having the savings and where we might still need some work and come up with different workflows. I mean, they've just been a great partner.
I don't think anybody could have predicted how quickly this program would become a mainstay in our business, and if this is the way medicine is going, it can only be a good thing, and I thank Remedy largely for being able to make this such a smooth transition.